Chapter 9, Late Adulthood, Physical Development. In this section, we will discuss an overview of physical development, physical milestones in late adulthood, physical development, and health issues. So let's start with an overview of physical development. Physical development is growth from birth to adulthood, and it's the development of both gross and fine motor skills. Gross motor skills being the large movements, and fine motor skills being the small, coordinated, small muscle movements such as your hands and your fingers. And it is the progress of one's control of the body. Let's look at some of the milestones in late adulthood. So, late adulthood is divided into a couple of age ranges. So there's young old, which is 69 years of age, middle-aged adult, which is 70 to 79 years, old, which is 80 to 89 years, very old, which is 90 to 99 years, and then over 100 years. So in late adulthood, some of the physical things that are going on is the brain becomes physically smaller and functions more slowly. There are gradual changes in appearance, especially in regard to the weakening of the body senses, organs. There continues to be losses in visual and hearing abilities. There's a decrease in the immune system and muscle strength. Short-term memory may decline as well. And there are age-related changes in regard to sexual functioning. So let's look at some of the physical growth in middle adulthood. So a vast majority of the physical changes are closely related to the process of advanced aging. So physical functioning and daily activities are a part of the organ system degeneration. Now, the process of aging in late adulthood is termed as senescence. And this is just the general effects of aging combined to make the body's organ systems work less effectively. Now, at first, people can compensate for this, but as they age, it becomes more and more apparent. Also, during this time, there's changes in the collagen, which closely parallel to the changes through the body. And collagen is just this fibrous protein that's used to connect tissue. So the flexibility of the collagen allows for muscles, blood vessels, tendons, and other organs to transmit tendon and experience compression without being deformed. But as the collagen starts to change, people can't move around in a normal way. Also, calcium deposits begin to deposit in tissues. So there's also changes in height and weight in late adulthood. In regards to weight, there is a decreased physical ability, which means that less food needs to be consumed. There's a lower metabolism, there's poor health, and all of these related factors result in a reduction of muscle and tissue mass. Height is also continuing to reduce, and this is caused by the compression of the spinal column and the softening of the muscle and bone tissue. And it also causes a stooped posture with the head held forward and the body down from the body. So also during late adulthood, there continues to be changes in teeth. Now, total loss of teeth does occur in a sizable majority of people between ages 65 and 74. Again, this is due to gingivitis and periodontal disease. Now, dental problems can also contribute to eating issues and can lead to malnutrition. Some people don't get dentures due to financial reasons, or the dentures may not fit properly, so they may only be able to eat foods that are easy to chew, which causes them to not get as many nutrients as they could from foods that require more chewing. So there also continues to be changes in the muscular and skeletal systems during this time, and the ability to move about gets more restricted as aging advances, especially in regard to the changes of the muscle and the bone functions. So there's a loss of elasticity in the muscle tissue, which reduces flexibility and causes stiffness. So osteoporosis is part of this as well, because the bones can lead to easier breakage, and also is part of having a humpback posture and the S-curved spine column known as scoliosis. So back pain also increases in frequency and intensity during this time. Arthritis and rheumatoid arthritis are also prevalent, and other conditions that cause disability or discomfort are things like muscle cramps um, and gout. And gout is just a metabolic disorder that results from crystals forming in joint areas, and it causes extreme pain when pressure is applied. So changes in the cardiovascular system are very much like what happened in middle adulthood, but it worsens. So there's further accumulation of fatty material in the heart muscle and in the arteries, and the heart valves thicken and the arteries harden. So this causes higher blood pressure, excess stress on the heart, and other cardiovascular problems. Again, the heart does grow during this time to try to counteract for the difference in the blood flowing through the body. There is also a decrease in cardiac output. So the slower heart rate of older people results in decreased levels of oxygen in the blood. And this results in them being more tired and not being able to endure as much as they could when they were younger. Coronary heart disease also increases. So this is the leading cause of death at this age, and it stems from a diminished supply of oxygen to the heart muscle, and it can lead to heart attack and congestive heart failure. So changes in respiratory systems, and this is caused because the lungs have lowered capacity for inhaling and exhaling air. And there's three main causes for this. One is the change in the collagen composition of the lungs, and it causes them to be less elastic and less capable of expanding and contracting, so they're less flexible. The diaphragm and the chest muscles that help expand and contract the chest also weaken. And then there's age-related symptoms such as scoliosis, which reduce chest capacity since they're more hunched over and have that S-shaped back. So there's also some serious respiratory conditions that do occur during late adulthood, but they can also occur in middle. And that's cancer in the lungs, which is primarily caused by smoking, pollution, and occupational hazards. Emphysema, which is a condition involving the deconstruction of lung tissue, and it results in a lower lung elasticity. So people with emphysema have trouble breathing and moving around freely. They may need oxygen tanks and things like that. And then pneumonia is an inflammation of the lungs, and this increases in late adulthood because of the decreased lung efficiency, poor circulation, and lower resistance to infection. And it's at higher risk for people that are in bed who aren't able to be physically active, so they have trouble clearing the infection that is in their lungs. So there's also changes in the digestive system, and these problems just increase from middle adulthood. Some of the most common reported digestive disorders are constipation and hemorrhoids, hernias, gallbladder conditions, heartburn, and diverticulitis. So constipation and hemorrhoids, these are caused by not having a daily bowel movement, and this may be more of a matter of socialization than a true effect of aging. So in later adulthood, there's a higher rate for hemorrhoids, and people that have constipation and issues with hemorrhoids are reliant on laxatives to help them produce regular bowel movements, and it's often related more to dietary practices than it is to aging. So a lot of people that suffer from constipation and hemorrhoids are suggested to add more fiber to their diet so that they can have more frequent bowel movements. So hernias are a condition which a portion of the stomach slides up, or it exits through the wall of the cavity where it normally sits. So this is common among elderly, especially those who are overweight and obese, and it can cause things like indigestion, heartburn, chest pain, and difficulty with swallowing. And it's typically treated through therapeutic methods and surgery. So gallbladder conditions, these include things like gallstones or an inflammation of the gallbladder. So the gallbladder stores bile from the liver, And gallstones form from an insoluble substance in that bile. Now, serious problems happen when gallstones block the duct leading from the gallbladder to the intestine. So you can kind of see a picture of it right here. And it causes things like gallbladder attacks, a lot of pain in regard to that. And a lot of times it's remediated through surgery and removing the gallbladder and the gallstones. So gastrus is what is known as heartburn. And this is an inflammation, irritation, or erosion in the lining of the stomach. And it can be acute or it can be chronic. So acute gastrus is when it suddenly happens, and then chronic is where it gradually happens over time. And there's lots of things that cause it, especially the foods that we eat. So having a poor diet, having nutrient deficiencies, smoking, being overweight, all of these can cause this. And a lot of times, even spicy foods as well. And it's typically remediated through over-the-counter antacids or prescribed antacids. So diverticulitis is an inflammation of a portion of the intestine that causes pain, nausea, and a change in bowel habits. Now, diverticulitis is typically treated with surgery unless the infected area of the intestine perforates or it ruptures. And people with diverticulitis have extreme pain, especially when they're trying to have bowel movements and things like that. And once you have diverticulitis, you have to be very careful with the foods that you eat, because there are certain foods that can cause flare-ups and cause a lot more pain. So doctors prescribe drinking lots of liquid, low-fiber diets, cooked fruits, and cooked vegetables, and staying away from things that have seeds, red meat, fat, processed sugars, and carbohydrates, because those will cause diverticulitis flare-ups. So there's also changes in regard to the kidneys, the bladders, and the urethra. And as people age, there is a decrease in blood flow through the kidneys, as well as a gradual decrease in the kidneys' efficiency to remove waste from the blood. Now, incontinence is something that happens in late adulthood, and it's very real and it's very embarrassing. And incontinence is just the inability to retain urine in the bladder until voluntarily going to the bathroom to relieve that urine. Now, men commonly experience enlargement of the prostate gland during late adulthood, and this could cause blockage in the urine flow, and it can result in bladder infections and other complications. And the most common types of cancer in men are bladder and prostate cancer. Now, women have more urinary system problems than men, so things like bladder infections, and increased risk for problems in the vaginal area, especially in regards to prolapsed urethras and cancer of the cervix, vulva, and the breast. And breast cancer is one of the leading causes of death among elderly women. So also during this time, there are changes in the brain and the nervous system. Now, the speed of nerve cell transmission slows with age, and the brain and nerve cell numbers decrease. Now, these changes decrease reaction time and other cognitive processes. So reaction time affects perception and memory, as well as soundness of various reflexes. So they may not have as much hand-eye coordination as they used to. Slower reaction times can also endanger the safety of elderly people, especially when driving and especially when multitasking. Now, reduced availability of oxygen to the brain can also contribute to other conditions and are troublesome. So things like sleep disturbances, memory difficulties, and irritability are all related to cerebral blood flow and the changes in the biochemical functioning of the brain. Insomnia is one of the most frequent complaints in late adulthood. So there's also changes in sensation, perception, and motor skills during late adulthood. So the ability to adjust and adapt in late adulthood depends primarily on how they receive and process information gained through the senses. Now, as we get older, senses start to deteriorate and we're not able to smell or hear or taste things like we used to when we were younger. So elderly people experience sensory deprivation as the sensory organs and the area of the brain that regulates them decline. And this deprivation has implications for mental alertness and contact with reality. So changes in vision. So as we've learned, as you get older, your vision continues to change and decrease. So in late adulthood, there are age-related changes that do increase. So like a need for light, a decrease in the sharpness of vision due to the changes in the lenses and the pupil size and accommodations. So being able to focus, and also a decrease in adaptation to dark and light environments. So it takes a little bit for them to come in from outside into a darker room for their vision to focus. So elderly people also experience several eye disorders that can limit visual ability. So things like specks in their vision field, and that's just where you have floaters in your eyes, and then macular degeneration, which is a decreased blood supply to the retina, causing loss of visual sharpness when looking straight ahead, but not in the peripheral vision. And then also drooping eyelids. Now, the risk of blindness also increases during this age, and it's primarily due to glaucoma. So, changes in hearing. So, hearing loss, just like vision, decrease as we get older and we age. So, hearing loss and handicaps will increase, and hearing loss can lead to social withdrawal because social interactions deal a lot with being able to hear and comprehend what people are saying. So, hearing loss does occur earlier in men due to their hazardous noise environments, and hearing loss in the mid to low range frequency becomes more likely with age. Again, like we talked about in middle adulthood, being very mindful of what we listen to and how loud we listen to things does have an impact on our hearing. While we may be able to hear while we're still young, it can have detrimental impacts on us in the future. So looking at our headphones again, being at that 90 decibel level, which is right there with the sound of a motorcycle. So many elderly people also become deaf because of the cochlear hair cell damage, bone hardening, and the inner ear structure nerve damage that transmits sound. So a lot of elderly adults may need things like hearing aids to help them process and understand what people are saying. So changes in taste and smell. So taste and smell go hand in hand. What we smell indicates what we taste. So taste, many elderly people remark that food tastes bland and they need to season it more heavily to improve its flavor. Now, the loss of taste is attributed with the number of taste buds and the needs for stronger stimulation for those taste buds to be able to taste what they're trying to eat. And then smell. Smell also decreases, and it decreases because of the number of fibers in the nose. Now, this decline is very important in regard to safety implications because as you get older, you may not be able to smell things that are burning. So if you leave something on the stove or the gas is left on, you may not be able to detect that, which can cause some safety issues. So we're going to pause and process what we have covered so far in regard to the slides. So go back and review as needed to answer these questions. So health issues in late adulthood. So here are some common chronic health conditions that occur in late adulthood. So the majority of elderly people are in relatively good health. However, as we've discussed, their physical development does start to decrease. So they will typically have one or more chronic conditions that require medical attention, and they also experience acute illnesses like influenza, but less frequently than younger people. So an acute illness are more severe and of longer duration than it is among younger people, and that's primarily because their immune systems are not as strong as they used to be, and they're often hospitalized for illness more frequently than young people, also as a result to their declining physical abilities and also physical health, and because of their decreasing immune system. Now, medical expenses do also play a major role in the elderly's budget as well. And some chronic complaints in late adulthood are things like cardiovascular disease, hypertension, arthritis, hearing impairments, cataracts, glaucoma, and lower back problems. So, nutritional needs during late adulthood, like I said earlier, they are starting to decrease in the amount of physical activity they do, and they also need less um, calorie intakes than they did when they were younger. So there is a relationship between their diet, exercise, and health, and it continues to be strong, but they need to reevaluate what they eat, how much they eat, and how much they exercise. So many health problems are related to diet and eating habits, things like lower resistance to disease, poor absorption of nutrients, elevated blood pressure, dehydration, and the risk for colon, uterus, breast, prostate, kidney, and pancreas cancer. So to decrease these risks, a diet should emphasize fruit and vegetable consumption, and nutrition is just as important as it was in the earlier years. So some factors that contribute to poor nutrition are their declining health and general well-being. Tooth loss is another one because they're not capable of necessarily chewing and eating some of the foods that are more healthy. So eating a crunchy carrot may be a little bit difficult for someone that does not have teeth or has poor fitting dentures. Declines in taste and smell also have an impact on their poor nutrition because they're more out to eat things that are more desirable than things that have bland taste. Limited incomes also play a big factor because fruits and vegetables are a lot more expensive than going and buying a box of Little Debbie cakes. Physical disabilities also contribute to poor nutrition due to exercise and being able to get around and getting to the food that they need. Forgetting to eat is something that occurs in late adulthood as well. And then loss of appetite, and then misconceptions about nutrition and eating a balanced diet. A lot of adults think that they are eating a balanced meal and getting the nutrients that they need. However, to alleviate some of these problems, taking vitamin and mineral supplements is one of the best ways to make sure that they're getting all the proper vitamins and minerals that they need. And there's lots of chewable versions of these and easy to swallow for people that may have trouble with eating or chewing and things like that. Also, community programs like Meals on Wheels also try to promote improved nutrition among the elderly by bringing meals to them. So some common illnesses and disorders during late adulthood. Strokes become a leading cause of death among elderly people, and strokes are when a blood vessel in the brain ruptures or is obstructed by a blood clot. And an aneurysm is something that can cause a stroke, and this is a rupture of an artery wall within the brain. And there's a couple of different types of aneurysms as well, depending on where it is and how large it is. So some early warning signs of stroke are sudden or temporary weaknesses or numbness in the face, arm, or leg, difficulty with speech or vision, and unexplained headaches, dizziness, or a change in personality or mental ability. Now, most people who have strokes can expect a limited recovery. Therapy is often one of the main things to help people get back some of those motor skills, fine or gross, depending on how extreme the stroke was. So, mental health during this time, one of the greatest fear that people have about growing older is losing their mental capacities and becoming senile. So senility is a marked deterioration in mental organization characterized by confusion, memory loss, information processes difficulties, and disorientation. And this is often referred to as dementia. However, there are numerous non-Alzheimer dementias that vary in cause and symptoms. So, dementia is a global term for a variety of organic brain disorders related to brain cell impairment. And symptoms of dementia include things like disorientation to time, space, place, or people, memory loss, disturbances in thinking, especially abstract thinking and reasoning, impaired judgment, and inappropriate emotional responses. Now, symptoms may appear slowly or rather suddenly. And there are two main forms of dementia. It's either acute or chronic. And acute is a form of that is reversible, whereas chronic is one that is not reversible. So Alzheimer's disease is a degenerative chronic brain disorder that occurs most commonly in late adulthood. And it's characterized initially by forgetfulness and then later by serious cognitive dysfunction. Now, eventually, it will have complete loss of mental functioning and will lead to death. Now, there's not an exact cause, but genetics may play a role. And there's no cure for Alzheimer's, but drugs can slow progression and help someone with some symptoms. Now, Alzheimer's and dementia are different, even though a lot of times you'll hear them used simultaneously. Dementia is a clinical syndrome, and Alzheimer's is the most common cause of dementia. Now, caring for someone with Alzheimer's is a very taxing, but it can also be a fulfilling task. Now, the thing about people with Alzheimer's and caring for them is that they need around-the-clock care. And this could be very costly to families, both financially and emotionally, depending on if they have someone coming in for Alzheimer's care or if a family member is doing the care. Now, it's extremely difficult for family members to watch this as a person changes. So it's this process of them changing and trying to remember that the disease is not who they were. So it's this part of just watching them change into a completely different person that you don't know, and that your loved one is lost and not the same person that they were. Now, religion can help family members cope with this, and some people believe that suffering is a process that unites them to Christ and brings them closer to God. So this process is just helping them to be closer with God. Now, there are support groups as well that devote to helping people and family members cope with loved ones' Alzheimer's disease. So Parkinson's disease is another chronic brain condition that occurs in late adulthood. And this disease is characterized initially by tremors, muscle weakness, and a particular gait when they're walking. Later on, it causes slurred speech. Now, it involves cell impairment in a part of the brain, and it does eventually lead to death. Now, these cells produce dopamine, and dopamine is a neurotransmitter that is responsible for smooth and coordinated movements of the muscles and in the body. So that particular gait it was talking about, it's going to be very rigid and jagged when they walk. And it's not until 80% of these cells have been impaired or died that a person even begins to show symptoms of Parkinson's symptoms. And around 85% of diagnosed cases are people that are over the age of 65. So stem cell research is a very controversial topic in the US. And this is because of where stem cells come from. So it's an ethical issue because some stem cells come from embryos and then some come from adults. And we're going to talk about that a little bit more in just a minute. Now, stem cells are cells capable of becoming another more differentiated cell type in the body, and stem cells can be used to replace or even heal damaged tissues and cells in the body. So there's beneficials of using stem cell, but the research behind it is controversial in regards to where these stem cells come from. So there are two main types of stem cells. There's embryonic cells and then tissue stem cells. And these would be somatic, which are adult stem cells, amniotic fluid stem cells, and umbilical cord or placenta stem cells. And we're going to talk about these more in just a minute. So embryonic stem cells initially come from a human embryo, which ceases to live as a result of obtaining the cell. Now, these are obtained from miscarriages and aborted fetuses, and this is one of the main reasons why it's so controversial. Now, researchers have zeroed in on the use of embryonic stem cells in developing treatments due to their ability to differentiate into many types of cells. Now, adult cells from skin, bone marrow, and umbilical cord also shows this flexibility. So because they found out that there's flexibility in these adult cells that do not have to come from miscarriages or aborted fetuses, this could avoid using that altogether and is seen as more ethical in society. So somatic stem cells, these are adult stem cells and they're obtained from patients or donors found in numerous tissues and organ systems. Now, somatic stem cells can come from bone marrow, fat, or reprogrammed skin cells, umbilical cord, blood, or placenta after birth, and amniotic stem cells. Now, somatic stem cells provide many ways to obtain stem cells. So it really does reduce that need to use those embryonic cells that are so controversial. So let's look at a comparison between these two. So embryonic stem cells, they're difficult to induce growth in the desired cell or type of tissue, whereas somatic stem cells have begun specialization so that inducing growth in the desired cell type can be easier. And one of the main things is that in the embryonic stem cells, no current disease treatment or cures have been developed at this time using that type of stem cells. Whereas somatic or adult stem cells, there are several dozen diseases that have been treated or cured using these, including cancers, autoimmune diseases, cardiovascular diseases. So going back and forth between the two and the ethical principle, it seems that somatic stem cells are more beneficial in terms of research because these have actually been used to create treatments and cures. So suicide is something that does become prevalent in late adulthood. And this is primarily because they're moving from that being independent to being dependent on people again. So there's multiple things that occur that cause suicide in the elderly or for the elderly to want to commit suicide. Socially, their life changes, losing their jobs and their driver's license, being alone, grieving, depending on their demographics, so being a man, white, increasing in their age, changes, environmental factors, impairments, their health, their personality, and things like that. And if we look over here, we can kind of see in the US in 2002, there is a greater increase in suicides as we get older in age, particularly around white males and black males, and then women are below that. Same thing in the States. Looking at the ones in red have the highest numbers of suicide rates in elderly. So promoting wellness in late adulthood, health behaviors do become habit in early life and can set a person on a certain course as they age. Now, it's not too late for them to adapt healthier habits to improve their health and increase longevity, but it is going to be harder to break bad habits that were developed earlier on. But some habits that are very helpful are things like getting enough sleep, not skipping breakfast, controlling one's weight, and exercising. And there's lots of accommodations for things considering that flexibility and muscle strength are lessened in late adulthood. So things like aqua aerobics and things like that are very popular in late adulthood in regard to exercise. So again, we're going to pause and process what we have covered so far, go back and review the slides as needed to answer these questions.